Bismillahirrahmanirrahim. This is me, Sahar, and I'm here to present on the topic Awareness Assessment about Usage, Health, and Environmental Impacts of Face Masks during Covid-19 pandemic. To the best of our knowledge, this is one of the first and few studies conducted in Pakistan regarding the criticality of face masks. Though being a new and innovative topic, there was limited research available in this regard, yet our study tried to enlighten almost every aspect related to face mask usage. Since I've researched a great deal of what people use to opt as preventive measures or non-pharmaceutical interventions in the pandemics in the past, they weren't so different from the pandemic that we're dealing with right now, be it Athenian plague that occurred in 430 BC, which affected Ethiopian people, or be it swine flu of 2009 that affected US, Mexico, and Australia, or influenza that devastatingly spread around the globe in the year 1918 to 1919. People were advised to cover their faces in order to stay safe from the virus, and they were advised to maintain a safe distance from each other. So the concept was there, but the actual thing has come into play in the recent times of the 21st century. COVID hard hit the world by the end of year 2019, and it seems to be endemic in nature. It has shocked the world to some very horrible states during its spread around the globe. WHO strictly advised people to wear face masks, be it symptomatic or asymptomatic people, to avoid the virus spread, leading to more face mask usage globally. Amidst the global viral discourse, people have learned that they can still be guarded by means of using personal protective equipment, such as face masks. Many of you have, have practiced these all precautionary measures, as you can see in the slide. For instance, we take China as an example. In the start of February 2020, the rate of production of face masks rose up to 20 times the rate of in June 2020 when the cases rose evidently. So I've broken down the objectives for everyone here to understand what our study actually aimed at identifying. So the face mask usage patterns was to be seen among general population by keeping in view their knowledge and attitude towards wearing mask trends, and in accordance with analyzing the mask composition, along with evaluating its impacts on human and environmental health. A self-constructed questionnaire was designed that contained 33 queries and was distributed among 400 individuals. A face-to-face questionnaire survey was conducted, and their used masks were sampled in order to analyze the chemical component present in them. The purpose of obtaining those used masks was to see the majority of the type of masks used and the major chemical component present in them. The questionnaire was designed in both English and Urdu, and so that because it was for general population, so it was kept in mind to see how it was easy for everyone to understand. Urdu questionnaire quite facilitated people with low educational level who might have found it difficult to understand the terms and conditions and the questions asked in the questionnaire. Moving along the face mask health on human health. As you can see in this picture, we've broken down the health impacts into psychological and physiological impacts. The picture on the right describes the psychological impacts, and as you can see, how the barrier of communication when you're wearing a mask, you can't express your emotions, and it, creates a state of anxiety and depression among you. Also, face masks are imposed on people regardless of their choice. So when something's imposed on people, they don't feel they are hesitated to wear it. Also, people with claustrophobia suffer excessively due to wearing face masks, as they feel quite congested with the feeling of wearing the face mask. Also, that people with hearing and mental disorders, their expressions and gestures are impeded when they're wearing the face mask, and this has, exacerbated the situation of anxiety and depression among people. Coming towards the former, the physiological impacts, we know that the humid environment beneath the mask and the continuous rebreathing of the same exhaled air. Also, that when the mask is unfit, the air goes straight into the eyes and causes eye irritation, number of skin problems, and ear discomfort, nasal discomfort. So, masks have an innate capacity to form microfibers. The greater the release of microfibers, greater the inhalation of them. So breathing problems were the most witnessed problem in our questionnaire survey. Face mask impacts on environment. I can't even begin to count the irreversible impacts face mask has once they enter the environment. We therefore took 4 types of masks and identified their nature. It wasn't surprising to us. It might be surprising to all of you that masks are literally composed of plastic. Literally plastic. You all have been wearing plastic so far as your face covering. There's a dire need to realize that the ill use of preventive measures might lead us with another pandemic awaiting of plastic pollution, where face masks or other biomedical waste be indulged completely into every ecosystem of the environment, covering the entire planet. So it is of utmost importance to take into account the plastic pollution occurring from face masks globally. Unfortunately, face masks are topping the list as a dormant source of plastic pollution in the land and aquatic biota, where they are doubtlessly ingested by microorganisms and organisms at the higher level. They not only hinder the normal functioning of microorganisms, but they also affect the human and cause chronic health problems once they enter the food chain. So land sites and ocean beds are littered with these plastic use. You can see them, they're discarded by hotels, restaurants, their houses, and they can be seen on parking lots, roadsides, gutters, beaches, landfills, and so many more places. So these were the types of masks used, and I will be explaining how they were analyzed in our study in the further slides. So these were the study areas we selected based on the basis of a high number of COVID cases. High number of COVID cases, high mask usage, high rate of mask usage. I've broken down this picture into different colors so that everybody could understand how many individuals were selected from Lahore, from Islamabad, and from Rawalpindi. So since I've told you it was to be assessed among general population, we tried to take every individual, be it children, elderly, salesmen, healthcare workers, professionals, students, everyone, so that we could, there was an aim behind diversity in our population size. It was to obtain a perfect representative sample. So here are the cloth mask analysis. We broke down the mask into its layers, and we experienced and we saw that every layer is composed of polymethylpentene in our survey. Whereas in cloth mask, the first is cellulose paper filter, whereas the other 2 are composed of polymethylpentene. The next mask is N95 mask, and it has 5 layers. And the first and the outer and the inner layer are composed of polymethylpentene, whereas the inner layers are composed of polyester and polypropylene. Surgical mask analysis. Surgical mask was the topic of most of our survey respondents. And as you can see, all of these layers are composed of polymethylpentene. The graph here represents the wavelength on x-axis, while as the absorbance is seen on the y-axis. The defined infrared library is the one in blue color, and our sample was represented in red color, and complete overlaid spectra were formed, representing that there were complete plastic components present in the mask. Sorry. Here's the homemade mask analysis, and there were two layers. The first one was of cellulose paper filter, whereas the other was of polyester fibers. Most of the reactions were seen from the surgical mask, as it was mostly used by general public, and they mostly experienced allergic reactions, and they experienced fibers getting off the mask. The first graph on the left, represents almost all the questions, a complete summary of the questions that were important in our survey. For example, the usage of masks, be it the health issues or the environmental aspects. So the other side represents, the blue color represents the people that had reported no issues, while the right side, you can see the options are always, frequently, and not at all, always, sometimes, and frequently. Take it as people who had reported issues off and on. So sore throat wasn't that of an issue seen in our survey, whereas discomfort in breathing was a major issue. Headache and anxiety issues were seen, and the other discomforts were combined and varying discomforts, such as skin and nasal discomfort, acne, rashes, itching, redness. All such were seen, and all can be witnessed in the graph on the right. Conclusive results were that 46% individuals belonging to age group 21 to 30 had followed all precautionary measures, and they used surgical masks the most. Most of the health impacts, such as sweat, breathing, and nasal and skin issues, were faced by the above-mentioned age group. Whereas the 54% respondents belonging to middle class adopted all precautionary measures, and they experienced fiber getting off the mask since they washed and reused their masks the most. 27% respondents from Islamabad adopted all precautionary measures, and 50% individuals from Lahore experienced sweat and breathing issues, while 23% candidates from Rawalpindi experienced skin and nasal discomforts. I would conclude my presentation by saying that regardless of the health impacts and the concerns faced by Pakistani population, they are more inclined towards wearing the face mask. The recommendations here are the cloth and homemade masks should be worn by a general population because they're more environmental friendly as compared to surgical and N95 masks, respirators, and because they are to be used by they are medical grade masks, and they are to be used by medical care workers. So stockpiling of such masks should be prohibited, and it is preferred to use wash the face mask rather than single-use face masks. And awareness campaigns should be run by the government at large scale regarding the use of reusable PPEs, their appropriate disinfection when washed with normal laundry, and making them accessible to general public. That was all for my part. Thank you so much. Thank you so much, Ms. Sahar, for sharing your research.
Say no!